Hi, I am Dr. Parag. I am a consultant and director at PInnacle Ortho Center. I am a hand surgeon. Today I am going to discuss a most common topic in the field of hand surgery, and usually we see this problem in every household person. I am going to discuss about infections in the hand. I am very sure many of us would face infection in the hand, and many times we try to treat these infections at home without taking the help of a doctor. If we discuss the commonest problem to get the hand infections, usually the causes are either the medical problems in the patient that causes the immunity to subside, and because of low immunity, infections in the hand they catch and they become worsen. And second common problem is direct trauma to the hand. It can be either at workplace or while working in a kitchen, or somebody who has to handle a sharp object in the machines. Usually they have a direct trauma and then they can get the injury in the hand, which if we don't clean or if we don't treat them properly, they can cause infection. Another important reasons we have seen nowadays is toothpick injury. Many times we use toothpick after visiting a restaurant or after having our dinner. We try to clean our tooth with the toothpick, and usually if we don't take care of it well and we keep the toothpick in the pocket, and many times we have seen when somebody tries to remove the toothpick, they get the sharp object injury, and if we don't clean it nicely, that can cause a serious infection in the hand. Another important cause is when somebody lands up in a fight with somebody, and if we hit on somebody's face, they get an injury on the knuckle, and it is because of their saliva gets infection on the knuckle. Common symptoms of any hand infection: either they get a redness in the particular area, they get restricted movements, there could be a swelling, and there could be a significant functional disability. Somebody who is not able to make a full fist, or somebody who has swelling in the hand with no reason. Sometimes if the infection is into the deeper tissues, they may get fever. Usually hand infections subside by taking oral medications, but there are warning signals. If the oral medications do not work in the form of antipyretics like paracetamol or a painkiller, or antibiotics, if the redness, swelling and movement in the joint does not improve in 48 to 72 hours, usually these infections needs to be seen by an expert. When we analyze this infection, and to explain you in a simple language, in the hand we have 5 different anatomical parts like skin and fat. So many times the infection in the skin and fat will present like a term called cellulitis. Means there would be a redness in the skin, there could be just a swelling in the skin, and it is so painful if you press it on the swelling, and then there could be a depression on the skin. If the infection is involving deeper structures in the hand, like cables which are responsible to move our finger and wrist, they are called as tendons. If the infection goes deeper to the tendons, they can have a serious infection called tenosynovitis, which usually do not subside with medications. If the infection lands up into the tendon, patient can have significant restriction of the hand movement, and usually they need surgery. Third important location is infection in the bone and joints. I would like to explain you, apart from other joints in the body like shoulder joint, knee joint, where there are a lot of muscle bulk around the joint, but in the hand there are hardly any muscle bulk, or there is hardly fat. So any penetrating injury, any sharp object injury at the joint level can cause direct entry and direct introduction of a particular bacteria or infection material into the joint or bone. So a diagnosis of osteomyelitis means infection into the bone, or septic arthritis means infection into the joint, can cause a serious destruction of the joint and definitely a significant functional compromise. After explaining the deeper tissue involvement in the infection, how do we proceed about the treatment? Of course, every patient first goes to a family physician or orthopedic surgeon for the treatment. If 70 to 80% of the initial stages of infection can be controlled by simple antibiotics and painkillers, if we control their medical problems like diabetes, if we improve their immunity, then definitely this infection can be controlled. But many times, if the infection does not settle in a week time or a 5 days time and it is causing functional problem, then we would like to have X-ray to know whether the infection has involved joint or bone. We would like to take a X-ray to know whether there is any foreign body into the finger, like a toothpick or a wooden stick or something like that. We may have to find out infection because of the fracture in the bone which was not treated initially. Then sometimes, to rule out whether the infection is into the muscles or fat or tendons, we may have to do a good sonography to know whether there are pus in the hand, whether there is any collection in the hand. Usually sometimes we may have to consider a MRI scan also, but sometimes the infection has to be treated by surgery. Surgery can be of single stage or multi-stage depending upon how delay the presentation of patient to us. Sometimes these infections we have to consider a surgery in the form of debridement. We have to clean the infection completely up to the bone and tendons so that it doesn't cause recurrence. In spite of best treatment, there is a minor possibility these patients may have repetitive infections in the hand and they need repetitive treatment. Apart from surgery, once the wound heals better, then sometimes these patients need physiotherapy as well to get the better function into the hand. In my opinion, a simple warning signs, we call them as a red flag signs: pain, swelling, redness around the hand, reduced movement into the joint, and fever or low immunity conditions like diabetes or malignancy or age related issues. We should not neglect these symptoms into the hand and we should try to consult expert as early as possible, because there is a chance that we may get away or get this infection cured without surgical intervention. Even if surgery we may have to perform, if we do it in a very meticulous way and try to eradicate the infection right up to the deep tissues, the chances of recurrence are really less and patients to go back to their normal function can be done significantly early. Kindly contact Pinnacle Ortho Center if you notice any of these symptoms and try to consult a hand surgeon. Thank you.